Welcome to the NADTC Poll and Campaign webinar on Transportation Needs and Assessment Survey of Older Adults, People with Disabilities, and Caregivers. We're really glad that you could join us today. I'm going to give you a couple of webinar logistics before I turn the session over to your presenters. First, the webinar is being recorded. This is important to note that if you do post something in the chat box, it will be public and it will also be included with the recording when it's made available after the session. We will take questions during the session today and at the end of the presentation. To ask your question, you can post that into the chat box, which is to the left of your screen, the left and at the bottom. You can do that throughout the session. You don't have to wait until the end. We do have closed captioning today. Thank you so much to our captioner for being with us. You can access this in one of two ways. You can either click on the CC icon at the top right, or excuse me, top left of your screen, or you can press Control plus F8 on your keyboard. A separate box will open that you can customize the size and font to your liking. If you're having any trouble with the Blackboard functioning or getting connected to Blackboard, you have two options. You can call the Blackboard Technical Assistance line, which is 877-382-2293, or you can email me, Christy McLaughlin. I emailed the connection information this morning and again just a few minutes ago. So if you want to respond to that email and let me know the issue you're having, I'll be watching for that and can assist you in getting connected. With that, I am happy to turn the session over to Virginia Dyes, the co-director of the NADTC, to get everyone started.
Thank you, Christy, and welcome everyone. We're so pleased that you're joining us this afternoon. Just quickly to go through the agenda, I'm going to say a few welcoming remarks and introduce the report that we're talking about. Then turning over to Carol, who will begin a summary of the national poll results. I'll follow up and continue with that report. And then we'll have, hopefully, some time for facilitated discussion and questions and answers. And we're very eager to hear what you all have to say in terms of your reaction to what we have to say, as well as any stories that you want to share from your own experiences. I do hope, I know that Christy sent a link to the report, to the full report. If you haven't used that link to access it, you can go on the NADTC website and access it by going to Resources and Publications. It's the first publication that will pop up because it's our most recent publication. So feel free to do that. I'm assuming that most people on this call already know who we are, but it never hurts to say, and there may be some newer people who have joined us today. We are the National Aging and Disability Transportation Center. We are a partnership of Easter Seals, where Carol works, the National Association of Area Agencies on Aging, where I work, and the Federal Transit Administration, which is our funder. Our overall mission is to promote the availability and accessibility of transportation options that serve the needs of older adults, people with disabilities, and caregivers and communities. We do person-centered technical assistance and information. We do lots of training, both by webinar, online courses, and in person. We do a lot of outreach and communication, including our e-news. So if you don't currently subscribe to our e-news, you can do so on our website. And we do partner with lots of organizations, including the communities that we fund through our grant programs. And there is an independent program evaluation of our center that is done on an annual basis. This is the cover of our report that was published in December. We did a press event here in D.C., had some good press that followed up with that to draw attention to the transportation needs of older adults, people with disabilities, and caregivers. Next slide. So why did we do a national survey? Because quite honestly, I think that those of us who have worked in this field for quite a while, and I've been in the transportation field specifically for 10 years now, why are we doing a national survey? Well, in part, it is to hear the voices of older adults and people with disabilities and caregivers to ensure that we're on the right track. We all assume that we know what those transportation needs are and what those problems are. But we felt that it was time to really get to the voices of those who need transportation and who use transportation resources in the community to find out what their experience is like. Next slide. We turn to a professional research organization, KRC Research. And one of the great values of working with researchers who do this all the time is that they made sure that the people that we included in our survey are representative of the demographics of the United States based on the census. So, for example, older adults are persons 60 and older, and it was weighted to ensure that the disability percentage of older adults is well represented. 33% of the respondents who are older had a disability that either limits them in physical activities, in seeing, and or hearing. We had 509 older adults included in our sample. 309 of those completed online surveys, and with older adults we did 200 telephone surveys in recognition of the fact that older adults are less likely to be online than younger adults with disabilities or caregivers, even though that percentage is growing. Next slide. Our sample of younger adults included 513 individuals, 18 to 59 years of age, who are living with disabilities, including 413 of those surveys that were completed online and 100 done by telephone. And again, we define disability very broadly to include persons with physical limitations as well as disability in seeing and or hearing. And again, the sample was weighted to ensure that it was demographically accurate according to the U.S. Census. Next slide. And finally, our transportation caregivers. There were 627 caregivers, and these are caregivers of persons ages 18 to 84. So it included a mix of caregivers of younger adults with disabilities as well as older adults. And we specifically wanted caregivers who provide or arrange transportation for an adult family member or friend. So those were our criteria for selection of caregivers to be included in our sample. There were 390 caregivers of older adults included, as well as 237 caregivers of younger adults with disabilities. So as we're presenting the results of this survey, and really what we're going to be presenting are the highlights and a summary, we'd like for you to think about this question, and we are going to conduct a poll at the end of our presentation. So do the poll results, the results of the NADTC survey, reflect your knowledge and experience working on transportation issues in your community? So we hope you'll think that keep that in mind as we turn to the summary. So Carol, I'm turning it over to you.
Hi, everyone. I'm Carol Wright-Kenderdine, and I am a co-director of the National Aging and Disability Transportation Center along with Virginia Dyes. we are really excited to be able to give you the actual results in summary form of this transportation survey that was done just recently, because we think that it really is telling in terms of what's going on across the United States. We really want to also know if it matches your experience. So as Virginia just mentioned, we're eager to have you pay attention as we go through and see if the results that we share with you are similar to what you're seeing in your communities. Then later, if you would share with us if it is true that these are the kinds of things that you're seeing, we'd like to know that. But we'd also like to know if you're seeing something different in your particular communities, because we want to make sure that the needs are truly reflective of what people are finding in their own locales. The first point that we would like to summarize talks about older adults and younger adults with disabilities and their ability to drive. We found out that most of the people who are driving their own vehicles or riding with family or friends across both age and disability anticipate a time when they're not going to be able to drive any longer. And they believe that finding alternative transportation will be difficult. So they're already anticipating a time when they aren't going to be able to have the freedom that they currently experience with the transportation as they know it today. The second point that we want to summarize is relative to caregivers. We know that caregivers play a pivotal role in helping older adults and individuals with disabilities meet their transportation needs. And we also know that most caregivers are happy to help, but they were quick to point out to us that providing for or arranging rides is extremely time-consuming. When asked what are their biggest concerns about the person that they're responsible for caring for is driving, caregivers of older adults with disabilities reflected back on the safety and concern for their loved ones, and they did so in very specific ways. One said, they're starting to forget to turn their headlights on or look for oncoming traffic at intersections. Another said she's not confident of her reaction time. She does not like to drive in bad weather or on busy streets. One caregiver, in talking about the older adult they were responsible for, said he cannot see clearly during the day and almost not at all if it gets dark suddenly. Overly cautious and poor reaction time. And still another said, my biggest concern is that this person doesn't realize how compromised their driving has become. So it's clear that caregivers certainly worry about people who are in their the responsibility for their care, have responsibility for their care, and yet recognize that they probably aren't safe operating their own vehicles. When asked, what would you like to see in the community that would be helpful for the people that you are responsible for, more public transportation and affordable options were frequently mentioned as solutions for caregivers. One caregiver of an older adult with a disability said, I do not live all that close, so I would love to see a service that would transfer her without my help, since taking off from work is stressful. Many people get caught in that situation where they're responsible for someone else, but they're still in a position where they need to live their own life as well. And so having those options available in the community can make a big difference for caregivers. The third point in our survey, the results said, those who give up driving face big barriers to getting around. They can no longer do the things they need and want to do. They face physical isolation, frustration, feel dependent, and trapped. We asked them to tell us what that was like in their own words. A 34-year-old with a disability said, I can't go to social events unless the person giving me a ride wants to go. I'm stuck places until whoever drove me wants to leave. I don't get to pick where we go most times. So certainly the control of one's life and what they do is out of their control. A 59-year-old with disabilities said, I'm unable to go anywhere by myself, such as doctor's appointments, hair appointments, dentist, grocery shopping, or personal shopping. It takes your independence away. Very life-altering. A 47-year-old with a disability said, I've had a few quick job changes come along that I was not able to secure because I could not get there right away. Having a car means freedom. And a 63-year-old with a disability said, I was not able to go to my grandson's high school baseball and football games and school plays, something most of us take for granted. Yet another point that was made is that most older adults and younger adults with disabilities who do not drive are not using public transportation. This is important for all of us to recognize. When those options are available, many times they're not being used by older adults and people with disabilities, and it's important for us to understand why. We also know that it depends on where you live, that if you are in an urban or a suburban area, you have much more alternative transportation options than you do if you are living in a rural or isolated area. And so it's important for us to understand why people make the choices they do and what kind of transportation options they have. So these are just 4 summary points of our survey, and I'm going to turn it back over to Virginia, and she's going to provide the results of some of our other survey results from the poll.
As you can tell by a quick look at the survey, this was a survey that was generally representative of the United States, so it wasn't specifically focused on rural areas. However, there was some further analysis done of a few of the critical points in the survey, one of which is found that fewer people in rural areas or small towns say that their transportation alternatives are good. As a matter of fact, there are some real differences there. In general, older adults find that they have good alternatives, about 62% of the respondents, whereas if you look at just the rural responses, it goes down to 49%. With younger adults, you have an even bigger range because you start out with 75% of younger adults with disabilities saying that they have access to good alternatives, whereas younger adults with disabilities living in rural areas, only about 45% note that they have access to good alternatives. Again, what's really powerful, I think, about this survey is what individuals shared with us. So public transportation, as Carol pointed out, is often mentioned as a need in communities. For older adults, an affordable transportation service, as one 60-year-old without a disability said, an affordable transportation service for senior citizens and the handicapped that live in rural communities is what's needed. Whereas another 60-year-old without a disability also pointed this out, that an effective public transportation system that runs frequently rather than occasion is needed. Younger adults with disabilities, a 49-year-old said, I live in a very small town. We only have one company with 2 vans that pick people up. I live in the country, and they don't come out here this far. We need help in rural areas. And finally, a 51-year-old with a disability said, buses that run on the weekends. There are no buses that go between local towns on the weekend, and the buses that do run in the town don't run on Sundays. I think these are powerful statements that reflect the situation that people are living with. Our next summary point is that older adults and younger adults with disabilities who don't drive face many barriers, including access to affordable transportation options. Fully 8 in 10 non-drivers with a disability say that they're unable to do the activities and chores that they need or like to do. It's a lower percentage for older adults. Only about 40% of them say that they are inhibited from doing those necessary chores and activities. And for those of us who have been working in aging for most of our careers, I think what that reflects is the fact that with older adults, there may be giving up and choosing to just stay home when transportation is not readily available. So clearly not driving, which we've known for many years, but it really does affect people's lives. Next slide. Those who give up driving report feelings of isolation, dependence, and loss of enjoyment. A younger adult with disabilities, age 33, said, "I have lost independence, spontaneity, pride, sense of accomplishment. I have to prearrange everything and rely on others to get me places, wait for me, and drive me home." And an older adult with disability, age 75, says that he has to depend on his wife to get around, and it can sometimes be a very helpless feeling. Another finding, and I have to say this was a bit of a surprise, that there's no single recognized go-to information resource that our respondents reported for finding out about alternative transportation options. And most people are turning to family and friends for help. We also found that most caregivers are turning to family and friends for help. And I want to give you, go into the details a little bit here because I think it's very important for us who work in the field to know this. Fully 43% of older adults and 48% of younger adults with disabilities are saying that they're relying on family and friends for information. 24% of older adults and 31% of younger adults with disabilities are then turning to the computer, to the internet, to their cell phones to get information. When we talk about the organizations that many of the folks on the phone might work for, area agencies on aging, centers for independent living, aging and disability resource centers, 13% older adults and people with disabilities use area agencies on aging. 8% of older adults and 12% are using centers for independent living. 11% of older adults and 16% of younger adults with disabilities are going to aging and disability resource centers. And finally, mobility managers, who we all know play such a pivotal and important role and are present in a growing number of communities around the country, though certainly not everywhere. Only 2% of older adults said that they were going to mobility managers, and only 8% of younger adults with disabilities are using mobility managers. And if you look at the results for family caregivers, it's much the same. 7% of them are turning to mobility managers. So I'd say that that underscores the critical work that we all have to do in terms of getting out the word and ensuring that people living in the community know where to go. More information about public transportation is definitely needed. An older adult, age 60, says, "If I get to where I'm unable to drive myself, reckon I would have to think about moving closer to town. That's not an option at this time in my life, nor would I want to." A younger adult with disabilities, age 32, says, "There should be more public transportation. Maybe more information should be given to the public through social media or news." And finally, a caregiver says, "A list of transportation services would be handy, along with any other information for the elderly." The final point of our summary is this. The majority of older adults and younger adults with disabilities expect transportation options to stay pretty much where they are or to get worse. Many would be comfortable using various kinds of transportation, including public transit, if it were available in their communities and if they knew about it. So with that, I'm going to turn it back over to Christy and ask her to conduct our poll. Christy?
Yes, thank you so much, Virginia. So if you are able to or interested in participating in the poll, rather, you can do so in the chat section. At the top left of your screen within the participant box, there is a drop-down menu. You'll see a box with a check mark in the middle of it. If you hover over that, you can select yes or no to answer the question. Do the poll results reflect your knowledge and experience working on transportation issues within your community? So if you're able to do that, that will give us a real clear idea of the results. We'll be able to post those within the window for you guys to see here in just a moment. But if you are not able to hover, if you're instead using a screen reading software, for example, you can also vote in the poll by pressing Control-1 for yes and Control-2 for no. So you have that option as well. Virginia, whenever you're ready for me to post those results, just let me know.
Okay. I think we'll give folks a couple of minutes to think about that and make sure you're following Christy's instructions correctly. Just as an aside, we are going to have an opportunity for questions and answers, so any top-of-mind questions. I know that Carol and I have thrown out a lot of information to you guys, and it's a lot to absorb. Believe me, I've read this report I can't tell you how many times. And I still am finding nuggets of information that didn't strike me the first 7 or 8 times I read it. So it's a very dense report. There's a lot of information. But I think we've tried to point out during this presentation, one of the critical things is the way people feel and what their actual lived experience is. And I think that it's really, we see it as a wake-up call to figure out ways that we can better serve the transportation needs of older adults and people with disabilities, which are so critical to help people connect to needed services as well as counter social isolation. So with that, Christy, I think I'm ready for you to open up the poll.
Okay, fantastic. So I will post the poll results. These are the results as they were entered into the participant window. So there are actually several additional yeses in the chat box, and so if a person voted just in the chat box and not in the polling feature, then it will not be included in this. But the responses are overwhelmingly yes. So I think that as you can see there, we have 38 yeses, 1 no, and then the rest are those that have not responded.
Okay, woo, that's a relief. We're glad that that's the case. And so at this point, I think we're ready to open it up to you all. If there are any questions in the chat box or if people want to use the phone feature, Christy, perhaps you could ensure that everyone knows how to do that.
Yes, we can take questions via the chat section, which is at the bottom left of your screen if you want to post those there. We're unable to take questions over the phone, but you can also email your questions if you want to respond to the connection email that was sent out earlier today and yesterday. I will take your question at that point and put it into the chat box so that we can address those and so that the presenters can address those. So you have 2 ways, either through the chat box or through email, and by responding to your connection email, and we'll make sure that your questions get presented.
We do have one question so far, Virginia. One is, what was the geographic area of the survey?
It was nationwide. So it's meant to reflect the overall experience of older adults, people with disabilities, and family caregivers in the United States. We have the demographic details are included at the end of the report. and they're a little bit more detailed than what we showed on the slides. They include, for example, whether the age range, male or female, and we also include representation of the Northeast, South, Midwest, and West. For example, about 41% of younger adults with disabilities and 38% of older adults are living in the South. 18% of younger adults with disabilities and 16% are in the Northeast. So if you take a look at the back of the report, you'll see that demographic breakdown that is expected to be nationally represented.
We do have several questions in the chat box. We'll just go down the list if that's okay. The next one is, are there plans to use this information for national level legislative advocacy?
I can take that, Chrissy. This is Carol. We are not allowed to do actual legislative advocacy as the National Aging and Disability Transportation Center because we receive federal funding that is prohibited in terms of what we do. But what we hope to do is to educate everyone, and that includes legislators, that includes the public, that includes providers across the country for what the needs are, and then to help create solutions. So not only do we want to identify what are the needs out there, but we want to work with all of you and others to find solutions for the problems that have been identified. So we are working on the next steps as we speak in terms of trying to figure out if these are problems that have been identified, what are some of the solutions? And those solutions are going to vary depending on the part of the country people are in and the circumstances they find themselves in. But we are trying to come up with alternatives that people can use in terms of resources that are available through our National Aging and Disability Transportation Center. We're going to be talking about some of those resources coming up at the end of this webinar that you can take advantage of very soon and know more about. But we also are trying to work with communities. So if your community has a particular issue and you are looking for some kinds of technical assistance, or some resources, or you want to be put in touch with other people who may have experienced some of the same things you have and have found some creative solutions, then it's our job to match you up with them and help you tackle some of the things that you are experiencing in your particular area. So while we can't advocate on a national or statewide basis even for doing public advocacy, we can educate people and we can provide resources that will help work towards solutions for some of the problems that have been identified.
Great, thank you. The next question is, how were participants chosen?
It's a random sample. So we put our trust in our researchers who are experts at developing a random sample and who are made the decision that they were going to ensure that the sample was representative. So you see a few less older adults than younger adults with disabilities and a few more caregivers being included in the sample. That was to ensure that there was a balance and that they were truly representative of the population in the United States. And that's really what we endeavored to do. So we didn't particularly target a particular profile of older adults or people with disabilities. We were looking for folks who represent overall the population in the country.
Great, thank you. The next question actually came in via email, and that is there a plan for a follow-up survey at any point?
This is Carol, and yes, we have plans for a survey for this coming year, but it isn't the same kind of survey. This survey will be to talk about potential solutions and things that people are doing in terms of the kinds of things that have been identified as needs, and also to find out what other kinds of things that people would like to know, other than what we have already asked questions about. Are there things that weren't included in this survey that people would like to know more about? So our survey will take two different formats, and one will be looking at what else do we need to know, and two, of the things that were identified, what are some of the best practices out there, what are some of the solutions that exist so that we can help develop resources for communities.
And this is Virginia. I'd like to add to that. We held a discussion with folks after we did the press event in December, and we got some recommendations from some of the folks at the press event to conduct some additional analysis of the data that we've collected. And we are open to suggestions about whether or not there needs to be some further analysis of some of this data. For example, one of the recommendations that came through, we particularly looked at a couple of data points with regard to people in rural areas and small towns versus people living in suburbs or urban areas. And we would like to take a further peek at this data that we've got to see if we can paint a more thorough picture of the situation in rural areas. So that's one thing that we're considering, but we're open to other suggestions as well.
Great, thank you so much. So the next question, and this may be a question that we can't address on this call, but I will at least give this the opportunity to give some resources. But what are some federal or grant programs available to help expand transportation in communities?
Yeah, there's that's a big question. There are some regular ongoing grant funding opportunities that federal programs such as the Section 5310 program that is targeted to persons who are transportation disadvantaged, particularly older adults and people with disabilities. There's the 5311 program that's targeted to rural areas, 5309 program, which is the bus program that is primarily used in urban areas. But there is a whole laundry list of those kinds of regular ongoing grant opportunities that are typically administered at the state level in your state or may be administered by an organization in an urban area. And those opportunities are listed on the FTA.gov website. There are also, from time to time, solicited competitive grant opportunities that the Federal Transit Administration offers. NADTC has a history of offering competitive grants, and this year we have offered a competitive grant to our planning grantees. So in 2018, we worked with 10 communities that were funded to do planning around the development of a program innovation in their communities. So we narrowed our competition this year to offer an additional opportunity for funding to those communities. Pending funding, hopefully we can offer a broader grant opportunity in the coming years. That's certainly our wish, but of course it's dependent on a lot of factors. So Carol, do you want to add anything to that?
Sure. If you'll watch our website, Every time that we're aware of any kind of funding opportunities that are out there, we post it on our website, so that's a good place to check on a regular basis. In our newsletter, anytime that we're aware of something that comes up and is a new funding source, we post that and send it out via our e-news. And so that, if you sign up for our e-news, that's a good resource for all of you to be able to use. If you go to grants.gov, that's a good place to be able to look for resources for grant programs that are out there that might be able to be used in your community. But networking within your community is important as well, because many times funding is available through sources that aren't necessarily related to transportation, but that are related to communities. And if you can partner with other agencies in your community, you can make those monies be useful for transportation as well as other things. Watch our newsletter, look for other opportunities to partner, look at federal sites. Those are all options for all of you. Money, as you know, is tighter all the time. But watch for opportunities where you can make your money go further by partnering with other organizations in your community and region.
Great, thank you so much. The next question may also be one where we're just providing a couple of resources or referral information, but I do want to make sure and present it to you guys. It says, if appropriate, can I ask, how are people advocating for volunteer driver programs when they are speaking to their elected officials, especially regarding the mileage reimbursement of $600 and the new interruption of the insurance liability issue for volunteer drivers?
Yeah, I'll start on that one. I think that's an issue that we would like to maybe connect the caller or the participant with some resources, particularly some local public volunteer programs, because those are unique programs. They're typically designed to serve a particular need in a particular community. So there's definitely, it's hard to make generalizations about them. I'd say one of the issues is that volunteer transportation can offer a less expensive alternative, but they're not free. And they're not free because it's very important to be able to offer some kind of remuneration for the drivers, especially when they're using their own car. But they're also not free because in order to operate them safely, liability, insurance, and protection are very important. So there are lots of complex issues involved in this. And we would be happy at our toll-free number, at our toll-free line, or an email address to provide some specific assistance. On the last slide, we list our contact information. It's 866-983-3222, and send an email at contact@NADTC.org. And whether you've got that information or others, we would be more than happy to be of assistance to you. Thank you.
Thank you, Virginia. And that actually holds true for any of the questions if we don't get to them today, or if you want to discuss an issue outside of this call. The technical assistance provided by the NADTC is fantastic, and you'll have all of that contact information at the end. So the next question, which is specific to point number 4 within the presentation, and the question is, any ideas on why participants do not use public transportation?
Hi, this is Carol. Yes, I think there are lots of reasons why people don't use public transportation. For one, as is the case with most of you who are on this webinar, we are used to getting in our own cars and going exactly where we want to go whenever we want to go there. And so until we need public transportation, we just don't give it a thought. It isn't until we don't have access to that independent travel that we even give some thought as to what we might need to do. And so, first of all, until it becomes a necessity, we haven't even thought of it as an alternative. Second, people who operate public transit assume that because people see our buses all the time, that they know exactly how to get a hold of us and exactly what it takes to ride the bus. But again, just because they know that there is a transit system in the community, it doesn't mean that they know how much transit costs or how far in advance they need to reserve a ride or what will happen when they call the number. Lots of times when they call the general number that might be posted on the side of your vehicle or that might be in the telephone directory, they get right into dispatch, and the first thing dispatch asks them is, where do you want to go and what time do you need to be there? And they might just be calling for information, and so they kind of panic and they think, well, I need more information than that, and it makes them very nervous to not know what exactly to expect. Virginia talked earlier about the need for mobility managers and the need to take advantage of mobility managers. That's one key issue. Another one is doing travel training and travel information, going out and speaking to groups and letting them know more about the transit system long before they absolutely ever have to use it. And not making the assumption that just because we put brochures in the community or because we have the telephone number on the side of the bus, that that's enough for people to understand what it takes to use our transit system. The other reason people don't use it is because it's not convenient. We are spoiled. We are used to being able to have on-demand transportation available to us so that when we want to go to the grocery store, we go to the grocery store. The idea that we have to plan perhaps as much as 24 hours or in some cases 48 hours in advance to be able to do that really makes it very difficult. Or as Virginia said, if you're an older adult and it takes a lot of work to be able to plan, or even maybe you have the perception that it's going to take a lot of work to be able to plan a ride, you say, you know, it's just not worth it, I'm not going to go. I'll wait until someone else can take me, or I'll wait until I can figure something out, or I absolutely have to go. And so there's lots of individual reasons why people don't take public transit. I think it's our job as people who work with public transit to make that decision as easy as possible. Most of the older adults who all of us know have never ridden a bus in their entire life. And so while we think it's no big deal and it should be an easy thing to do, they're hesitant to try it if they don't know what to expect. So what can we do to make that process a lot easier for them? And if we can look at it from a little different perspective and think about it from someone who knows nothing versus someone who thinks that the process should be easy, we will have a better perspective on what we need to do outreach within the community.
Great. Thank you so much. Excuse me. Our next question comes from email, and it says, what will be done with this survey information so that the efforts may continuing in acquiring more transportation?
Well, we have put it on our website. We're doing this webinar to get the word out. We've done other webinars since December when we first released the survey. We've done a couple of local webinars and teleconferences with folks, and we're very open to doing that. If you want us to come to your conference and make a presentation on it or whatever. The other thing that we have done to be helpful to folks is we have, for those people who are doing state research or want to do a state survey or a regional or local survey, if you contact us, actually if you contact me directly, and I'm at vdize@n4a.org. So that's Virginia Dize, VDIZE at small n, the number 4, small a.org. I'll be glad to put you in touch with our researchers if you would like some to ask any questions. We also have copies of the surveys that were used. Slightly, the same survey basically was used with older adults and people with disabilities. Some slight differences were made in that survey for the survey of caregivers. So we are willing to share those surveys with you. And we are eager, actually, to ensure that the word gets out. Feel free to take our survey, to download it, to point other people to it, to send people our way, because we definitely want people to know what the situation is, so that we are supporting, as Carol was talking earlier, we don't do political advocacy, but we do education, and we want to support your efforts to educate others or to advocate for your programs. And if using this data can be helpful to you, we say, way to go, let us know if we can be helpful.
And I'd like to add to that, we have shared all this information with FTA, the Federal Transit Administration, and they in turn have shared it with their leadership and the US DOT, and that's an important conduit for getting this information out and letting them know how important transportation is in communities across the country, and especially how important it is for older adults and people with disabilities. We had a national press conference, as Virginia told you about, and it was picked up by the national press, and we have done interviews with a number of local press and other national press outlets since that time. You are welcome to take the survey information and share it with your local press, and they are welcome to publish that information. That gets the word out across the country and makes it important in your area. You are able to share it with your local legislators. We can provide the information. You can do the advocacy based on what this survey says. There's nothing that says the information can't be used to advocate. We just can't provide the advocacy as an agency. You can take it to your DOT and you can say, look, this is what this survey is showing, and then you can show them with your information that you have the same results or that you have the same information, and again, use it to advocate with your state DOTs for your funding. We use the information to develop resources and have it available to all of you. We had a national convening following the press briefing, as Virginia said, and we had many different agencies who have a vested interest in this kind of information, and they have spread the information to their networks. So we're doing everything we can to really get the broadest possible spread of this information to people who have a vested interest in making sure that the needs of older adults and people with disabilities and their transportation needs, as well as caregivers, are served.
Great, thank you so much. So the next question, from an engineering perspective, what do you recommend to help or address this issue? Your input would be very helpful.
Well, neither Virginia or I are engineers. However, certainly transit agencies work with their MPOs all the time and their city engineering departments. And access to transportation is more than just having transportation buses or vans available to people. It's making sure that they can get to a bus stop. It's making sure that there are curb cuts. It's making sure that people have sidewalks that are available to them. And that's in rural communities as well as suburban and urban areas. And so from an engineering perspective, it's important that transit agencies are continually working with their city, regardless if it's a small town or an urban area, to make sure that access is more than just the bus itself, but the entire path of travel for people.
And I would just like to add to that there are wonderful, lots of technology interventions that are being created now to make travel easier for people with disabilities and older adults, and we welcome those. But I would say with every effort that is made, the critical thing that really needs to happen is to actually talk to older adults and people with disabilities and caregivers in your community. There's no good substitute for that. They can tell you things that will surprise you. And that's why we directed this survey to actual users of transportation or potential users. Because the lived experience and the difficulties that they have accessing rides, and some of the things that they're open to. One of the questions that we asked that we didn't talk about this afternoon was, would you be comfortable using a number of alternative transportation resources? And I have to say, the people who responded to the survey were overwhelmingly receptive and flexible about being willing to try if they knew about it, if it was available, and if it was accessible to them. So those critical issues, I think, they're engineering issues, they're planning issues, they're issues that affect the whole community. So we welcome the engagement of engineers in this process.
Great, thank you so much. So the next question is, one of the barriers for entry into non-emergency medical transportation services is not having enough underwriters wanting to provide auto insurance. Will there be federal or state regulation that may help improve this situation?
We don't know. The bottom line is we do not know. And, you know, there could be some stuff that's under consideration, but this is not something that we have particular expertise in. We can certainly try to connect you with an organization that may be of help if you want to reach out to us personally.
Great, thank you so much. So the next question, so few entities consider transit available in selecting their locations or in scheduling their events. How can we improve engagement of community centers, senior centers, libraries, courts, etc., in considering transit schedules in planning their locations and schedules?
I think one of the most important things that you can do is partnering with groups within your communities. It's really important that you know what events are coming up, and so that you can suggest to them the importance of transportation. And it's important for them to understand what your restrictions are. Many people know that there's transportation in the community, and they make assumptions that transportation is going to be available for their events without thinking about that maybe your hours are not the same as the hours for their event, or that your transportation could get people to the event but maybe not be available to get them home. And so partnerships and communication become really critical. You know, this is one of the advantages that rural communities have. If you participate on an active basis with organizations within your community and you know what is happening, for instance, you're a part of the Chamber of Commerce, or you are actively involved with a number of groups within your small communities, that's really a lot easier in small towns to be able to make those connections than it is in an urban center. And so knowing what's coming up and having them know what your capabilities are. Many times, too, they think that we're able to provide transportation for events and you can provide it just for their event without recognizing that we have restrictions such as it not being considered a charter. And so they don't understand the kinds of restrictions the transportation systems sometimes operate under. So again, I think it's opening those doors to communication. That's true when it comes to emergency management as well, making sure that your emergency managers in the area are understanding what your capabilities are so that when it comes time to respond, that they understand what you can do and what you can't do and what equipment you have and what you would be able to provide in those types of events and occurrences. So, you know, you can provide transportation for county fairs. You can provide them for other kinds of events that are happening on a limited basis in your communities. It'd be nice to be able to go to your people who organize those particular events and offer some of those services as well, because then they begin to know more about what it is you do, and when it comes time for you to get support from the community, you have some of that built-in support available to you because the relationships have been established.
I'd like to add a couple of things. One is, especially in an area where people are walking to the site of the event, et cetera, but even if they're getting off the public transit bus, it really is worth thinking about doing a walking audit, particularly for places like senior centers and other places where older adults or people with disabilities are likely to gather to ensure that there are no physical barriers that make it difficult for them to access the meeting place. And in addition to that, we are part of another project on inclusive coordinated transportation planning. And what that project is all about is about engaging older adults and people with disabilities of all ages in planning community transportation. There's a website, transitplanning4all.org. And that is a resource that has some information on former grantees and some of the things that they've done to ensure participation of older adults and people with disabilities in their project. And there is a document on there, on that website, about making meetings more accessible. If you have difficulty accessing that, please feel free to reach out to us. Or check out the website Transit Planning for All and contact another one of the partners in that project because I think that could be an enormously valuable resource for ensuring that everyone that you want to be at your meeting is able to get there.
Great, thank you so much. The next question is really a clarification on term definitions. So it says, you say mobility managers. Is that a position within public transportation and also trip planning, and shouldn't public transit take that responsibility?
Well, there's a complicated question. It depends. And mobility managers actually often are in public transit. As a matter of fact, the term mobility management is really a transportation term that others have adopted. But if you take a state like the state of Wisconsin, which is fortunate enough to have at the Department of Transportation level, they have taken the stand that they want to provide mobility management around the state, but they want the most reasonable, logical organization to come forward and apply to be the mobility manager. So you may have a mobility manager who works for a Center for Independent Living, a county office on aging, an area agency on aging, the whole 9 yards, as well as in public transit. So it really depends on the community, who has the resources, who has the will and the determination to ensure that there is a central place in the community where people can find out about transportation. But in order for any one entity to take on that role, it can't be done by one organization. One of the things that we require in all the grants that we provide under the NADTC is that there be coordination among the Public Transit Agency and other transportation providers. An aging organization in the community that may or may not be the Area Agency on Aging, and a disability organization that may or may not be the Center for Independent Living. But those three entities all need to be working across the aisles and among themselves to find the right place where if you're going to have one centralized place where information and assistance is provided on transportation, what is the right place in that community? Carol, did you want to add anything?
Yes, when it comes to travel training, we always advocate that transit agencies do travel training with people who may be hesitant to ride their transit systems and offer it on a regular basis across the community so that they go to the people and not necessarily make the people come to them. But you need to know that travel training exists in schools for transition for youth, learning how to navigate public transportation systems so that they know how to get to activities, they know how to get to jobs, they know how to get to social events, those types of things. Travel training happens in centers for independent living. Travel training happens in healthcare institutions. It happens in mental health facilities. So travel training happens in a number of different kinds of settings, not just public transit, because many organizations want to make sure that their clients and constituents are very capable of using transit to get where they need to go. But we always advocate that public transit develop transit training programs, whether it be a transit buddy system or it's done within staff within the agency, so that people feel comfortable using the transit program.
Great. Thank you so much. So at this time, we have one more question. I'll check again while you guys are answering this question to see if any more come in. But at this time, this is the last question, and it says, locally, access to transit stops has been explicitly excluded from transit planning. There is a huge need to include the path of travel to and from transit stops. Several local public works transportation agencies, planning, design standards, etc., do not address accessible pedestrian access. How can we improve collaboration?
NADTC has done a couple of webinars and has had an online course on pedestrian access. So there are a number of really good resources on our website. We have another course that will be coming up this spring that will address pedestrian access, so I encourage you to watch for that. There are a number of great resources out there that really talk about what the requirements are for pedestrian access and also what the best practices are for those types of things. If you're interested in some specific things, again, I would echo what Virginia has been saying, and that is contact us and we'll get those resources directly to you.
Fantastic. I don't see any other questions. Did you, Virginia and or Carol, have any comments you wanted to say before we close the session?
Yeah, a couple, and we've got another slide. I just wanted to, first of all, thank you all for your really good questions, and we hope that you will reach out to us if we can be of further assistance. We're also interested in, after you have the chance to look at the survey, if you have questions that arise then, if you identify something else that might be needed that you'd like to see NADTC take on, or have any recommendations to us based on the survey, we're very open to those suggestions. So feel free to stay in touch. Finally, we are launching a public education campaign that you may have heard of called the Every Ride Counts campaign. We're doing a webinar on this issue next week on Wednesday at 3 p.m. Eastern Time. We hope at that time to share with you some of the materials that we have available on our website. You can find this on our website by typing in Every Ride Counts. You'll get to a registration page. It's a very simple registration process. And once you register, you will have access to the full array of items that include a number of different photographic images as well as 8 different messages that communities can use to develop posters, postcards, social media messages to use in their own community and put their own local logo and local information on. So we hope that you'll join us for that webinar. Those are my last words, but I just can't say enough how grateful we are that you all decided to spend a good part of your afternoon with us today. We hope you found it useful, and we hope that you'll stay in touch. Carol, anything to add?
I have one big word for you, and it's the word free. Not very often that you participate in things and people say, all of our resources to you are free. The webinar that you would participate in next week is free. And all the resources that Virginia was talking about that your community can use, you can access for free. We know that many of you are from smaller systems and don't have a marketing person at your disposal. These materials have been designed by a professional design team, and you have the opportunity to have access to free materials that you can use in any way that you would like with no licensing restrictions. And so please take advantage of these kinds of resources, because it doesn't matter if you're a transportation agency or you're an aging services provider or if you're a center for independent living. There are things in these materials that I think you can find valuable and useful for your client base. So it isn't just a transportation model, although that's what it was designed to be. There are things that make a difference for all of the people that you represent. I'd like to echo Virginia's comments and thank you for your time today, and encourage you to look at the survey, because we think that the information is really valuable. And if you would share it within your communities and with your media, your DOT and others, that gets the word out and makes transportation a top priority issue across the country. So thank you for your time.
Great. Thank you both so much. A couple of quick comments before we close the session for today. I will be emailing all of the registered participants an evaluation for today's session. It is a short evaluation, and the information and feedback provided will be used to improve future NADTC webinars and other learning opportunities. So please take a moment to complete that. And then finally, thank you so much for your participation today. As Virginia mentioned earlier, here is the slide with the connection and contact information. There is a toll-free number as well as email address. You also have Virginia and Carol's direct email addresses as well. So please keep in contact with the National Aging and Disability Transportation Center. And as Carol mentioned here at the end, all of the resources provided as well as technical assistance is free, which is really fantastic. So thank you so much for your participation today, and we hope that you all have a great rest of your afternoon.